Hello, this is Josiah. I wanted to talk a little bit about how to reverse your high blood pressure. As many people are on medications for high blood pressure, you can fix this to some degree and start to reverse the process so that hopefully you can start reducing your medications needed, or at least for some people, completely reverse their need for medications for high blood pressure and hypertension. So, real quick, just to start, we want to know what this is. What are the main causes of high blood pressure? Now, there's a lot of factors involved in this. The typical family medicine doctor, unless there's some type of kidney disease, will call it essential hypertension, not secondary to something. So essential hypertension is just like a basket diagnosis. Like, we don't know exactly what's going on, but we'll treat this as hypertension, give a med. The two main reasons in almost all the literature for high blood pressure, excluding other diseases, the main ones are arterial stiffness. So those arteries that the blood's pumped through. If you look at the picture here, we have the heart and we have a single capillary, which the artery goes to. That blood has to flow through there and reach every single cell. In fact, a lot of literature says that a single cell, has to be right next to a capillary, no farther than the thickness of paper. It's like 100 millimeters. If that cell is not that close to the capillary to receive blood flow, it will die. So imagine how many cells that we have in our body. Trillions of cells, all have to be located near an arterial capillary to receive blood flow. That's a lot of plumbing. And the heart is responsible for pushing that through. Now, if we have stiff arteries, if these arteries get stiff, we're going to see our blood pressure increase. So typically arteries are muscles and they're supposed to expand as the blood flows through them to soften, constrict. If we're in fight or flight, they're going to constrict in certain areas and open up in more important areas like the organs so we can escape a situation or fight for our life. Another main cause of hypertension is kidney disease. Kidney disease, the kidneys needs lots of blood flow. They're a blood filter system. If they're lacking blood flow, they actually secrete hormones to increase blood pressure, to push to them some increased pressure so that they can keep filtering our blood and keep us alive. So arterial stiffness and kidney disease are the most common causes of blood pressure issues. So I want to talk real quick before we get into the nitty gritty about how to reverse hypertension and high blood pressure. A lot of the literature is actually suggesting now that inflammation is the cause of artery stiffening. And we can kind of see some of this here in this diagram. These are some inflammatory chemicals that when they increase versus the anti-inflammatory chemicals, that we get vascular aging and that stiffening of the artery as an adaptive response to the inflammation. That muscle stiffens and it becomes less pliable. So that's something that we have to consider, is reducing inflammation. So what can be done? Well, first off, in family practice, I always ask questions about sleep apnea, because sleep apnea is at night, essentially while you're sleeping. You may not even be aware of it. You stop breathing. And the brain has to kick the adrenal, fight or flight, that adrenaline in to wake you up to start breathing again. Imagine that happening 5, 10, 15 times every hour through the night, that adrenal dump to wake you up. You can imagine if the adrenals are constantly on, that constriction of the artery will affect our blood pressure. I've had young people in their 30s and 40s come in with undiagnosed sleep apnea with blood pressure in the 200s over 100s range. And we talked about sleep apnea, got tested, got the CPAP, and their blood pressure corrected. Amazing. The other thing that we need to do is we need to think about how to keep our arteries soft so as that pressure comes through, they can expand. Now, elevated cholesterol and triglycerides actually are bad for the arteries. It does form plaque in the arterial wall. But the other problem with some of the research is saying is elevated cholesterol and triglycerides actually are inflammatory, and they cause an inflammation response in this muscle of the artery, causing thickening and stiffening arteries. So getting that under control, dietary weight loss, you can work on that as a separate project. Triglycerides, I've corrected those with a lot of people just by reducing carbohydrates and sugars. They tend to rise with those types of foods. I know there's a lot of people saying, oh, it's fats. Well, yeah, they are a fat source, but they actually are triggered through high carb, high sugar diets. Blood glucose, so prediabetes and diabetes, is extremely inflammatory to the artery. It stiffens it. That inflammatory chemical response, it helps build plaque, which stiffens the artery, thickens the muscle. The body's only response to inflammation is to protect itself. And if it's a muscle, it's going to get stiff. So the other thing to consider is weight. So that pump, the heart, has to pump through all the hundreds to millions of miles of arteries. Well, I don't know if it's millions, at least thousands of miles, I guess, if we were to somehow be able to look at the capillary, which we can't even barely see without an electron microscope. Essentially, the more fat you have, fat is cells, the more arteries you have to build because the cell has to be within a paper thickness away from the artery to stay alive. So the more fat cells we build, the more arteries we have to grow, and the harder the part has to work to pump all that. So we're increasing our plumbing system, causing hypertension and high blood pressure, essentially. The other thing you need to do is you need to rule out a kidney disease. And how do we do this in family practice? It's a simple blood test. It's a filtration rate of the kidney based on a muscle protein called creatinine that the kidney is responsible for getting rid of and detoxing. If we have kidney disease dictated by a GFR less than 60, essentially, we start to step into chronic kidney disease that's more of serious concern. The kidneys need blood flow to filter. They're going to send chemicals, hormones into the blood to increase salt saving, increase pressure to save the kidneys from dying. The other thing that we need to consider is alcohol. Alcohol is a toxin. No matter how you want to describe it, it is a poison, essentially. That's why we get the effects on the central nervous system of feeling drunk. It is very toxic to arterial walls. I know there's a lot of stuff about wine having resveratrol, and there probably is a benefit to that, taking in very small quantities of moderation. If you have high blood pressure and you drink alcohol, trying to get off of it may help the blood pressure. The other thing we need to consider is vitamin D. Getting our blood levels around 50 or higher. Vitamin D, it's not clearly understood, has a relationship with keeping the arteries soft. So getting the vitamin D3 level, get it checked by the blood, get it around 50, and it will help you. So all these things could possibly reduce if they're elevated in your system. If we could fix some of these, we'll get 5 points here, 5 points there, 5 points there, and before you know it, your blood pressure is coming down. Now, the other way to approach this is to dilate the arteries. So we need to reduce salt. Why? Water is attracted to salt. So if we have a lot of salt circulating, we are going to attract water, which is going to increase the pressure on the artery. So we don't want to stop drinking water. We need water to live. What we need to do is reduce our salt. Some people are really salt sensitive. There's some genetic component in there that some people have a little bit of salt in every meal and it adds up and they have high blood pressure from it. Others are less salt sensitive and the kidneys can regulate that effectively and not have as much problem. The other thing that's been found in a lot of the studies is magnesium and potassium deficit. So the way magnesium is a dilator, it relaxes. We even use it in asthma attacks to open the lungs up. So making sure you got magnesium and potassium. Potassium tends to be the opposite electrolyte of sodium, and having those things in our diet. Now, one thing that's found is magnesium and potassium are in a lot of fruits and vegetables. So people that don't eat a lot of fruits and vegetables are going to have lower levels of that, and they probably have a high salt diet, and you can see how that can cause some problems with keeping the arteries open. The other thing we kind of discussed a little bit with the sleep apnea is that adrenal system, that fight or flight. It's there to protect us when you're trying to slay the saber-toothed tiger, it's always described, or run from the saber-toothed tiger. All that adrenaline helps us deal with the emergency situation. But if we're triggering that constantly, we're gonna start to we're gonna increase inflammation. Our arteries in the peripheral, where we check the blood pressure, are going to increase, and it's going to cause some remodeling in those arteries over time. So we need to get our stress taken care of. Mindful meditation, there's apps like Calm, 10 minutes a day, done every day for 6 months has been shown in some studies to help with that. Behavior modification, if we're a tense person constantly ready to flip a switch, we need to do some cognitive behavioral therapy to understand what's going on, why we're dumping adrenals. Maybe there's some other medical issue that hasn't been discussed, and get those things under control. So get the fight or flight taken care of. Get the potassium, magnesium, reduce the salt. Make sure you don't have sleep apnea. Soften the arteries by controlling cholesterol, triglycerides, getting our blood glucose down, losing weight to a healthy weight to reduce arterial plumbing so the heart doesn't have to work so much. Stop the kidney disease. Find out if you have kidney disease. Reduce the alcohol and get our vitamin D up. And those are some things that you can control to help with the high blood pressure. Thank you.